I'm Dr. Sanya. This is my last lecture on the circulatory system, where we were left with the anastomosis. What is anastomosis? It is the communication between the lumina of two tubes through collateral channels. It has almost three types: vascular anastomosis, organ anastomosis, and nerves anastomosis. As the name indicates that vascular anastomosis is between the vessels and organ anastomosis is present in the organs and nerves anastomosis would be between the nerves. Firstly, vascular anastomosis, which are also known as the shunt vessels. Here, two or more vessels anastomose with each other through collateral channels, which are called shunt channels. This has three types: arterioarterial anastomosis, arteriovenous, and veno-venous. Arterioarterial will be between the two arteries, arteriovenous between arteries and veins, while veno-venous will be between two veins. We will discuss them one by one. Firstly, the arterioarterial anastomosis. Here the muscular arteries join end to end. For example, the circle of Willis at the base of the brain, the vascular arcades in relation to the viscera of the gut, and here the joints of the limbs would be the example, and palmar and plantar arterial arches. All them have the arterioarterial anastomosis, means have the shunt channels or collateral channels. Second type is the arteriovenous anastomosis, where blood is not allowed to pass through the capillaries, bypasses capillary bed and sinusoids, and directly enter into the venous system. So the blood would be between the arteries and the veins. Then we have preferential thoroughfare channels. These are the further types of the arteriovenous anastomosis. Number one is the preferential thoroughfare channels, where we have the connecting terminal arteriole to venule. This channel gives side branches in the form of capillaries and provide alternate route for the blood flow. Second type of the arterioarterial is the simple arteriovenous anastomosis. These are the three types of this arteriovenous. Firstly, we discuss the preferential thoroughfare channels. Second one is the simple arteriovenous anastomosis. Here there will be the direct communication between branches of the small muscular arteries and their corresponding veins. Connecting vessel is straight with thick muscular cord and it is innervated by the sympathetic nerve fibers. When patent, blood is bypassed to exclude capillary bed from the circulation, and its examples would be the skin of the nose, lips, external ear, mucosa of the nose, and the gut. Then we have the complex arteriovenous anastomosis, where there is the glomeruli, which is the bunch. These are the coiled vessels, and the examples would be hands, digital pads, and nail buds. Then what are the functions of the arteriovenous anastomosis? They have role in the regulation of body temperature, absorption of nutrients from the gut, and regulation of blood pressure. Now the third and last types of vascular anastomosis is veno-venous anastomosis, which is between, as the name indicates, the small muscular veins. And its example would be the portosystemic anastomosis, anastomosis between the superficial and deep veins of leg through perforating veins, and dorsal venous arches of hand and foot. This is the diagram. You can see here the veno-venous circulation. These are different areas of anastomosis. You can see with the green circle the lower part of the esophagus. This one is the umbilicus, rectum. These are all areas of the portal anastomosis. Then we have the organ anastomosis, which is between the two or more organs, and it could be surgical. During surgery it may be created. Traumatic means during some injury. pathological, congenital means since birth, for example, the uterovaginal anastomosis. These are few examples of the organ anastomosis. Then we have the nerve anastomosis. It's not a true anastomosis. Some nerve fibers of a nerve may join in such a manner that individual nerve fiber does not divide. For example, Jacobson's anastomosis in the tympanic plexus and Gallen's anastomosis between superior and inferior laryngeal nerves. We have different vascular patterns. As you know, the end arteries, these are the arteries which do not anastomose. So if there is any blockage, there will be the resultant necrosis or infarction, because the area will not have enough supply of blood due to the blockage of dead vessels. For example, the central artery of the retina, this is an end artery and it doesn't anastomose. Thank you so much.